Hi, my name is Michael Seidman. I'm a medical doctor, I'm a surgeon, I'm a scientist, I'm also a nutritionist, and I've studied aging and health problems and complementary integrative medicine for many years. I want to talk to you a little bit about menopause and definitions and things we can do to help. Well, menopause really goes through perimenopause, which is 5 to 10 years preceding menopause, menopause itself, which is the 12 months without a period, and postmenopause, 5 years after menopause. It's really a continuum, and it's a gradual natural progression. It's not a disease. It's part of life, and in many ways, we should be willing to embrace it. I know that's easy for me to say, I'm a man, but we go through it too. You've heard of male menopause. Menopause definition really is a natural conclusion to the reproductive cycle. It really shouldn't instill fear. It's really a new beginning, more wisdom and confidence, some people have said. The problem is that you start to have more and more bone loss. It occurs during this time and for the next 5 years following menopause. There's much less circulating estrogen, the bone loss progresses, much more acclimated to the changes at that postmenopausal time, but then you have an increased risk of heart disease, Alzheimer's, diabetes, osteoporosis, and fracture rates increase dramatically. This is the logic of hormone replacement that many doctors have done, but there have been some risk to that, and also the logic of bioidentical hormones, which I think may be a bit safer, but it's controversial, and I can't tell you that it's not. There's many factors that increase the risk of menopause. We know that there are certain societies, some of the Asian societies where they have high amounts of soy in their diet, they really don't have menopause like we do here in America. And I think one of the things you have to realize is some of the biology. Estrogen is a class of hormones having estrogen activity. It helps with blood flow to the brain. It repairs nerve tissue, memory, bone growth, cardiac protector, heart protector. It's really estradiol, estrone, and estriol. It's important for bone breakdown or preventing bone breakdown. It reduces the risk of heart disease. It raises your HDL, which is the good cholesterol. It's responsible for female sexual characteristics. Declining estrogen leads to hot flashes, night sweats, mood swings, dryness, bladder infections, incontinence, decreased sex drive, and the list goes on and on. So these are some of the side effects of estrogen deficiency symptom, as you can see, and I'm sure many people who are experiencing this know what we're talking about. So why would you consider hormone replacement therapy? Primarily it's because people consider it because of breast cancer issues, heart disease, osteoporosis, memory declines, risk for Alzheimer's, dry skin, vaginal dryness, and other side effects that occur. So the side effects and risk of hormone replacement therapy are many, such as weight gain, gallbladder disease, fluid retention, bloating, headaches, depression, breast tenderness. Breast, ovarian, and endometrial cancer can increase. Blood clots can increase. There's a higher incidence of uterine cancer when estrogen is given without progesterone, which is a common thing that we do. So a lot of times, I like to point to this slide when I talk about it. I work for a health maintenance organization that's a wonderful organization, and I argue that we don't maintain anybody's health. We take care of you after you're sick. So I'm a big believer of swinging that pendulum back to the idea of prevention and optimizing health. So in many cases, our disease, or our treatments, I should say, are Band-Aids masking a symptom. And the patient's in the hospital talking to his nurse, and he says, I stopped taking the medicine because, frankly, I prefer the original disease to the side effects. And many of the women that I've taken care of over the years, from an alternative standpoint, think in that format. So bioidentical hormones have the same chemical structure as the endogenous hormones, the ones that you produce in your body. And we think, in many ways, that that's how they should be given to you. With that in mind, I want to talk about a few problems that occur that we're all seeing. Osteoporosis. It affects 30 million Americans. Females have 25% less bone mass than males do and lose about 1% per year, and females lose 2 to 3% per year after menopause. It's the most common cause of fractures over the age of 50. For prevention standpoint, you can build bones until about your 30s. You can drink 8 ounces of skim milk a day. It's got 350 milligrams of calcium. Collard greens, broccoli, turnip greens, pink salmon with the bones. Yum. Doesn't sound very good to me to eat the bones. Be careful because I might have to fish them out. Foods fortified with calcium, cereals, OJs, bread, etc. If you're going to take a calcium supplement, and we make one, I don't recommend Tums. That's what we learned in medical school. That's what your doctors tell you. It's calcium carbonate. It's not well absorbed. You want a chelated calcium, a glycinate, a citrate, a gluconate. It means that it's tagged to an amino acid, which enhances the absorption. You need somewhere between about 1,200 to up to even 2,000 milligrams a day. I don't usually recommend that high, but you got to make sure you take it with vitamin D. I also recommend phosphorus, boron, and magnesium as well. You can also prevent it theoretically by taking higher doses of vitamin C, isoflavones, weight-bearing exercise, limit your caffeine, limit your sodas. The pops that people drink have phosphoric acid. You've got to be careful with that. Eliminate tobacco and reduce your alcohol. Estrogen replacement therapy has been shown to help, but there's also been a suggestion that you can increase your risk of ovarian cancer by 1.5 to 2.2 times, and breast cancer can also increase as well. Hot flash is another problem. So one of the things that we use is something called sage and medicago sativa, which is actually alfalfa. It was actually shown to eliminate hot flashes and night sweats in about 20 out of 30 women. There are study after study to show that we can help using these phytoestrogens. Phytoestrogens are functionally similar to estradiol, and they really can help with nausea and bloating and hypotension, low blood pressure, breast fullness and tenderness. Other ingredients like dong quai, red clover, alfalfa, licorice, and black cohosh, and soybeans. There have been study after study looking at things like black cohosh. This was a randomized placebo-controlled study that looked and showed that black cohosh actually improved somatic and psychiatric measures compared to placebo, for example. In 700 patients, they showed a greater than 90% effectiveness at controlling and menopause symptoms with black cohosh. There is study after study, you can see some of them listed here as well, that have demonstrated the power of this ingredient. Dong quai is another ingredient which has been shown to help with menstrual cramps, PMS, menopause, abnormal flow. Soy, there are so many studies looking at the effects of soy, showing that if you increase your soy intake, hot flashes significantly decline. Multiple double-blind randomized placebo-controlled studies. They've also looked at protection against Alzheimer's disease. A study by Maki back in 2003 has shown a very strong positive benefit with using soy. Soy and heart health. There are multiple studies, I've listed 4 or 5 here, as you can see on the slide, that show that dietary soy has a role in promoting heart health. It improves your lipid profile. Multiple studies have suggested a significant benefit from using soy. Wild yam is another natural alternative to estrogen. Chaste tree berry, red clover, and we put these together in a very nice formulation, which we call our menopause support formula. It's an all-natural formula made in an FDA GMP certified facility. It's got the black cohosh extract, the dong quai, the red clover, the nova soy phytoestrogen extract, fenugreek, hops, damiana. And what you do is you take 2 capsules a day for the first week, increase to 3 to 4 a day as needed over weekly intervals for greater response. And again, I must caution that you don't want to use something like this if you have a known estrogen receptor positive tumor without talking to your physician. There is a lot of controversy about that. These are indeed phytoestrogens, and so we think that sometimes if somebody has an estrogen receptor positive ovarian or breast cancer, for example, or even a prostate cancer, although I don't think my male patients will be taking this, generally speaking. But the point of the matter is that there is some fairly compelling evidence that you need to be careful with this if you indeed have an estrogen receptor positive tumor. But there is controversy. There are other experts in the field who do not think that it is strong enough from that standpoint to impart a negative effect. But I would always say be careful and talk to your physician first. Thank you very much for your attention. Hopefully you'll take the opportunity to watch some of our other programs. Have a healthy day.